Welcome, everybody. Glad you're all here to learn about workshops for the National Tribal Health Conference. So let's get started here. Okay, so we're going to talk a little bit about the conference, about formats for workshops, how to do a submission, what a successful abstract looks like, some of the information about the theme for this year's conference and the types of content areas that we're looking for, and then some of the dates and resources that you'll need. And then we'll have time for any questions that you might have. So the National Indian Health Board was established over 50 years ago by the tribes to advocate as the united voice of federally recognized American Indian, Alaska Native tribes. And we seek to reinforce tribal sovereignty, strengthen tribal health systems, secure resources, and build capacity to achieve the highest level of health and well-being for our people. So one of the really exciting ways that we work towards that mission is the National Tribal Health Conference, which is the biggest event that we hold every year. And this year it's September 7th through 12th. It's near Phoenix, Arizona in Chandler. And our theme for the year is culture is medicine and community is healing. So that's a message that you'll see all over the conference, including as part of our workshops. So the workshops are a really key component of the National Tribal Health Conference. So these are the sessions that happen concurrently. They're usually a little bit smaller sessions, kind of can range in size depending on the topic. There's usually about 6 tracks that are going on at the same time. And so we'll have workshops slotted across all of those tracks, and they'll be going on at different periods every day of the conference.
We'll be having 2 separate formats for our workshops, which is pretty traditional for NTHC. The first one is going to be in a 75-minute format. These will be in-depth sessions. You can kind of see what this looks like in the pictures to the side. Some of them will be in rooms where you can actually move the chairs around and get everyone more engaged so that the sessions are more intimate. You'll get great feedback and engagement in those ways. You can have your boards where people could come up and join you and participate in various activities. And then we have breakout sessions, which are going to be a little shorter. They'll be about 45 minutes. And these topics may not need the full 75 minutes. So they may be a more brief discussion. And you can see several pictures below of these previous engagements that we've had in the past. And some of them may actually be you. So if you've been a speaker or a participant in THC, whether on the presenting side or the participant side, you may actually be in some of these photos. And we do have a couple of tips for helping you to decide which type of format you want to present in, whether you want to do the 75-minute or the 45-minute sessions. You can also select no preference.
Through the submission portal. And so we can share that link with everybody too. And then once you get in there, you'll need, so when you click the red submit button, then it'll ask you to either sign in or to create a profile. And so that's the first step. And then once you're signed in, then you'll have to kind of click the red submit button again, and that will take you into the actual form to go into the abstract submission process. So it only creates an account for this one submission portal, and it just needs your name and email address. And then that's so that you can get back in if you need to save it to finish it later or to check on the status or those kinds of things. You'll do all of that through this portal using your profile. And so that's why it asks you to create an account so that you can come back in and access it again if you need to. So that's the first step. And then once you're in and you're ready to start your abstract, we can go on to the next slide. So then the next step will be to enter all of your presenter information. So the first question will ask you whether you're a presenter or if you're submitting it on behalf of somebody else. And so that just helps us to keep track of whether you're, how to organize it, whether you're an author or not. So you'll put in, it'll have your name auto-loaded from when you created the account, and then you can put in the contact information. It'll ask you about whether you've presented at previous NIHB events. And so if you have, it's helpful just to share that if you shared at a public health summit or a data symposium or previous conference, that's great for us to know. And then which geographic region you serve. So we have those organized by the IHS areas, but it's really just about like which region of the country geographically you're located in. And then there's questions about access needs or accommodation requests. And so you can fill those out in that section also. And so once you have all of that, then you can add in any co-presenters or co-authors that you have. So anybody else that might be presenting with you, you can add those in here. And so those will ask the same questions for them, just their name, their email address, and we also ask here for like the bio so that we have all that information all set for the conference ahead of time. And you can add as many co-presenters as you need to. And it's helpful for us because then the emails should go out to all of your co-presenters at once when you get an acceptance or like the decision emails or those kinds of things. And then once you get into the actual part about the abstract, so that starts with the presentation title. You want something short, catchy, concise. That's what's going to be in the that's the part that's actually going to be in the agenda for the conference. And so you wanted to type it in however you would want it to show up in the, what gets published for the attendees. That's where you choose your presentation type about essentially how long of a session you're looking for. You can say no preference, and that's fine. We'll just slot you in wherever there's an opening. And then you can pick your conference track, which we'll talk about a little bit more in a second. You can pick up to 2 conference tracks that you think apply to your session best. And then you can add some keywords. So those help us to kind of track the major topics that it's talking about. It might be the population that's focused on. So if it's about youth, if it's about substance abuse, kind of whatever keywords that you would want to show up to help the right people to find your session. That's where you're going to put that. And then the next slide, the rest of the session information, you actually fill out the abstract. So that should include a short description of your proposed presentation, including the take-home value and impact for your audience members. And so you're encouraged there to also relate your proposal back to the conference theme, right, about like culture as medicine. The session description is shorter, so that's just going to be a really short description of the proposed presentation as you would want it to appear in the conference agenda if you're accepted. So that's the shorter version that the attendees would see. The abstract is the longer version that we review as the workshop review committee to kind of understand more in depth what the content will be. Then it will ask you about presentation format. So that's going to be where you can talk about whether it's going to be interactive, whether it's lecture-based, what kind of materials you might be using. So those kinds of things about kind of what the session looks like, not just the content, but how you'll do it. And then the learning objectives are also really important for us. So we want those to be clear and precise with what you want your audience to take away from your session, essentially. So like here are the top 2 or 3 things that when somebody walks away, this is what they're going to take with them. Okay, and then next slide. So then you'll have a chance to review all of your answers, and then you can either save it to come back later, and you can just sign back into your account and continue it later if you want to, or you can go ahead and submit when you're ready. Just make sure that you have hit that submit button before May 16th, or else we won't see it. So make sure you do, hit the submit button, and then that's how you'll complete it. And then it will give you your submission confirmation number. And then you should also get an email If you don't see an email, you can reach out to workshops@NIHB.org and we can try to troubleshoot and see what happened. So you can talk to both NTHC at NIHB.org is helpful, and then also the workshops email, which I will also share in the chat. So then you have that one too. So if you don't see an email from about your workshop submission, you might want to check your like junk mail for something that came from workshops@nhb.org. Okay, so next slide, we can talk a little bit about what we're looking for as we're reviewing these abstracts and workshop proposals. So some of the criteria that we're using or what we're looking for is especially that it's tribally focused is always our top thing that we're looking for. We really want this conference to be specific to tribes and really tailored in that way. So it'll be most helpful for our tribal audience that will be at this conference. We want it to be relevant to really current issues around health, whether that's health care, public health issues, health policy issues, but current to those health topics. We really appreciate sessions that encourage engagement and interaction. So things that have some way for the attendees to participate, to be involved, those are really encouraged. We're always looking for innovative and creative topics. So if there's something that we haven't seen before, that might be more likely to get accepted. We're always looking to elevate diverse perspectives, whether that's including people with disabilities or people who may be two-spirit or elders or youth or whatever kind of diverse perspectives might be represented either among your presenters or among the people that worked on the project. Those are really always appreciated. We're also looking for topics that are going to be replicable and actionable. So we're really focused on what that take-home value is going to be for our attendees. So what are they going to be able to take away from this? Is there something that they can bring back with them and implement for their tribe or for their health facility or public health department? What are they going to be able to do with the information that you provided? And so kind of along with that, we're looking for things that are really going to have value, going to have a measurable impact, and going to be able to make a difference for Indian country. And then we're also just kind of overall looking for whether the proposals are clear, whether they answer all of the information that we're looking for, whether we can really understand what it is that what your goal is in your presentation and what you hope to take away from it. So. And then again, those learning objectives really are a key piece that we always look at really carefully. Often the learning objectives are kind of, can be the decision point where we see of like, oh, like this is going to be really impactful and relevant for our audience. Or, this sounds like maybe it belongs better at a different conference or that kind of thing. So make sure you fill out those learning objectives carefully. And then on the next slide, as we're looking at our content areas. So the theme again is culture is medicine, community is healing. And then our main tracks that we're looking at will have sessions going on that have each of these different topics represented. So those include health promotion and disease prevention, behavioral health, resilient tribal communities. So looking at community level interventions, public health policy, infrastructure and systems, advocacy, law policy and federal relations, and then strong healthcare systems. So how do we strengthen healthcare delivery in Indian country? So those are our different tracks. So anywhere that you can address like one of those tracks or really show how your topic is really relevant to one of these key things that we're looking for, then that is usually kind of helps your score as we're reviewing them. So we can talk a little bit about kind of what these mean. So health promotion and disease prevention, we're looking at usually public health programs, things that are kind of focused on things that promote health and prevent disease, different types of programs and practices. So those can absolutely include things like how you're using traditional practices in public health programs or indigenous lifeways as primary prevention. Then these can be programs that address any type of public health issue, diabetes, cancer, interpersonal violence, infectious disease, HIV, tobacco, really any type of public health problem. So there's like lots of examples here. So those could be things like vaccine hesitancy, things around food sovereignty, health communications, the role of community health representatives, how to prepare for disease outbreaks or pandemics. All of those things would be relevant in health promotion and disease prevention. And you can do other things too that you think apply to that. These are just a few examples. The next one, hope in healing behavioral health. So this is really broad of any behavioral health topic. So that could include substance abuse, prevention, treatment, or recovery. It could talk about suicide. It could talk about other types of mental illness or other types of programs that are preventative and promote resilience to improve mental health. It could be tribal specific trauma-informed care, discussing historical and intergenerational trauma, or like, for example, the boarding schools. You could talk about ACEs, about how you've integrated culture into behavioral health programs, about working with Native youth and early intervention. You could talk about domestic violence prevention and intervention. So pretty broad there, any type of behavioral health, whether it's prevention or intervention. It could be kind of a clinical focus or a public health focus. Anything with behavioral health can fit here. The next one, advocacy. So these are things focused on law and policy and federal relations. So anything where you're talking about the impact of state, federal, or tribal laws on the policy, on the impact for American Indian and Alaska Native health and wellness. It could be talking about strategies to develop and advance tribal health policy priorities or legislative strategies. It could be talking about specific health legislation or regulation that has been having an impact for your tribal community. It could talk about strategies for kind of keeping an eye on what's going on at the government level or best practices in like evaluating law and policy. It could look at kind of a specific set of policies, so like around Medicaid or Medicare, and really focus in there. We've also in the past had sessions about different types of funding and how that relates to the different laws and appropriations policies that relate to funding for health services. And then innovative approaches to advancing tribal self-determination and bolster health systems across all different types of tribes. So that's that one. And then finally, healthcare systems. So these are anything that are about healthcare delivery, couldn't fit here, whether that's for self-governance or direct service systems. So a lot of discussions around Medicare and Medicaid and other types of third-party reimbursement are often fall into this category. Could talk about collaboration between like Veterans Affairs, like health systems, and then the ITU health system. It could talk about integrating traditional medicine into clinical practices, modernization of health IT, or discussion around healthcare workforce could also fit here. So anything that's kind of about clinical care delivery and like healthcare facilities are really good for this section. So, okay, so those are all of our content areas. So if you get accepted, then you would have to register for the conference. And so we want to make sure that you're aware that you would then be responsible for your own travel and accommodations expenses, but we do offer a reduced rate for speakers. So if you are accepted as a presenter for a workshop, you would have the reduced rate of $600 for your conference registration, which is a significant discount. For the actual presenters, that would be limited to 3 people to actually give the presentation, but your colleagues and co-authors are welcome to also attend the conference. We often receive multiple proposals on the same or similar topics, and so sometimes we might reassign tracks, or we might occasionally ask you to work with somebody else who's been working on a similar topic, and maybe share a workshop session to both give your presentations during the same time. So just be aware that sometimes we might need you to be a little bit flexible to fit in your presentation in the place that's going to be the best fit and fit with the flow of the conference. And then again, you don't need to complete the whole proposal in one sitting. Just make sure that you save your progress as you go, and then you can return at a later time. But make sure that you do complete it in its entirety and then hit the submit button for it to be accepted. And then just to be aware that we don't accept any proposals that are selling services or products. So the key dates to really be aware of is that all the submissions need to be in by May 16th. And then, so the portal will close at midnight Eastern time. And then the decisions should come out towards the end of June is when we'll notify you about whether your workshop was accepted or not. Okay. So there's the links that you need to get to the workshops portal, or to see kind of general information about the National Tribal Health Conference. And then I see there are some questions in the chat, so let's see if we can work through some of those, and then we can okay, so about like if you have additional information, like updating a bio after you've submitted it. So yes, if you are accepted as a presenter for the conference, you will then be sent a link for, I think it's called the Speakers Corner. And so from there, you can update any information that you need to about, like, you can add a headshot, you can add your speaker bio, you can make some other edits like that. So you will have the chance to do some of those other things post submission if you are accepted. So as far as presentation formats, Jessica, do you have any information about the SDPI poster session?
That is typically coordinated by our Associate Director for Infrastructure, Sarah Price. There should be information being released soon. We typically have one day reserved for the poster presentations to be set up. I do not have that information, but she's going to be coordinating all correspondences related to that soon.
Yeah, so our main presentation format is the workshop. So in the 2 different kind of time lengths, but the only poster session we have is one related specifically to grantees for the Special Diabetes Program for Indians. So that's what Jessica was talking about. So more information about the Special Diabetes poster session will come out pretty soon here, but otherwise it's just the oral presentations is our main format. Okay, so the emails to put on your safe sender list. Let's see if I can get these in the chat here. It's the workshops at nthc.org and then, or at NIHB.org, and then NTHC at NIHB.org. So those should be in the chat for you to see kind of the emails for where to look at. Oh, and then a question about whether there can be a moderator for a panel. Potentially. I don't know if you'll be able to. I think if you want to set it up as a panel discussion with an extra moderator, I think we might have to kind of address that on like a one-on-one basis. As I'm not sure whether the system will let you submit for presenters is what I'm currently trying to remember. But we can talk about it. It's probably a possibility. We might just have to make some side edits. Non-selected proposals will also be notified. But it's possible those might come out a little bit later. Sometimes it takes a couple of rounds of notifications. As we find out, like sometimes people drop out. And so sometimes we will come back and accept a few more. And so you might wait a little bit longer for a solid no, like not acceptance. The maximum of 3 presenters. If you have a situation where you need more than 3 presenters, you can generally the limitation there is like issues around space and microphones in the room. So, but we may be able to accommodate that in some circumstances. So especially if you're wanting, multiple tribes to be able to present together, collaboration is usually something that's great. So we can discuss if you like really need to have more than 3 presenters. Yes, we can share the slides. And then good question. What if we prefer to do a workshop, but would also be willing to adapt into a shorter breakout?
Yeah, I think we put that in the presentation as well. There should be an option when you're filling out your workshop information. There'll be an option for preference for format, and you can put neither if you are open to either format.
I think, I think in that case, you would just indicate that your preference is for the longer one. And then if we don't have room for that, then we'll, so even if you indicate that your preference is for the longer one, if we only have like openings in the shorter sessions, we may still come back and ask you if you would be willing to do a shorter version. So you should be okay to just say what your preference is, and then we will just fill them in as we have openings, basically. So generally the limit for co-presenters is going to be 3, especially if you're talking about a shorter breakout session. We wouldn't do more than 3 presenters in that case. If you have youth presenters, yes, you can pay the youth rate for the registration fee. How many total sessions are there over the conference? We're still working on our scheduling, so I don't have like the solid number for you right now, but we will have, I remember how many we had last year. I think we had about 35 sessions last year. So we might not have exactly, it depends a little bit on kind of space for each venue, and kind of what other things need to fit into the agenda, but there should be at least that many. Any other questions? Can you amend presenters after acceptance? Yes, we can make changes. I know sometimes availability changes and you need somebody else to present. So you can just email us at that workshops email and we can help to change if we need to make a change in presenters. Um, uh, and Jessica, do you know about scholarships?
I'm not sure. There may be some emergency preparedness related scholarships, but we would have to follow up with the specific program managers regarding those.
And Dr. Payment, I see your comment, so. Yeah, we can follow up.
And typically those are communicated through our newsletters, and on social media. So if there are any openings for scholarships, that information will be relayed through our public facing platforms as well.
Having some trouble adding the slides onto the Zoom, but we can send it out to all of the attendees. And all of that information is in the like on the portal page. So it's all of that information came out of either the FAQ or the call for proposals document. So you should be able to see that. The question about online poster sessions, that might have been for a different event. We don't generally have again, so the only poster session at the National Tribal Health Conference will be the ones presented by SDPI grantees. So we don't have a general poster session at the conference. And then the link to portal page. Jessica, do you have that handy? There we go. So for links, here is the general conference page, and then here's the page for the proposal workshop abstract proposal submissions are in that last link there. And again, that page will have all of the information that we shared in the slides. If for some reason my messages are not showing up because Zoom is having some trouble today, you can get to that from that National Tribal Health Conference page. Oh, and then Jessica just shared it again too. But you can also get to everything from the main conference page. There's a section about the call for workshop proposals. Any other questions? Okay, well, if you do think of additional questions later, again, you can always email that workshops@NIHB.org. Be happy to get back with you. And we're really looking forward to seeing all of the great submissions that are going to come in. The workshops are one of my favorite parts of conference because there's always so many cool things going on across Indian country. And so getting to get a little glimpse of all of the exciting things that all of you work on every day is one of my favorite parts of my job. So looking forward to seeing your submissions and let me know if you have any additional questions. And then I hope everybody has a great day. Thank you.